Good morning everybody and welcome to today's webinar on Wi-Fi Evolving Communications in Aged Care. My name is Chris Pulsford. I'm the National Partner Enablement Manager for Wavelink. What we want to do today is take a high-level view of enterprise wireless LAN or wireless local area network in aged care. This is a topic that a number of our resellers have expressed interest in because of the opportunities they're seeing in aged care. Many resellers have historically integrated DEC solutions into aged care and have now added voice over Wi-Fi and wireless LAN to their portfolio due to the demand that customers have for this sort of technology now. And many other resellers are in the process of looking at doing the same sort of thing and expanding their products and skill sets to be able to supply wireless LAN solutions and voice over Wi-Fi into aged care and healthcare in general. A lot of what we look at here today, while it is specifically based on aged care, really would apply to healthcare in general, so hospitals as well as aged care facilities. Although primarily out of those two, we do have a lot more customers, I guess, in aged care. However, certainly this stuff is popular in hospitals as well, and if anything, hospitals are probably leading the charge into the technology, and aged care sort of falls in behind that. So while some of the things we'll talk about today are probably fairly established in hospitals, we're also starting to see that flow down into the aged care market as well, so just keep that in mind. Some of the topics that we want to address today, Wi-Fi convergence. And really, as far as convergence is concerned, that could mean quite a lot of things, and throughout IT and technology, everything can be converged to some extent or other. So what are we specifically talking about in terms of convergence in the sense of Wi-Fi? Some of the usage scenarios that you can apply with wireless LAN or Wi-Fi, and I guess the flexibility of Wi-Fi is really allowing a lot of additional processes to be brought into the technology realm and improve the staff's capability to deliver services and look after residents and provide a better level of care as well. Application integration is a big deal, and really probably one of the main reasons why voice over Wi-Fi handsets have really started to surpass DEC in terms of volumes in new sites certainly, and also refreshes, is because of the level of application integration that you can achieve on a voice over Wi-Fi device as compared to a DEC device. And certainly what we're talking about is enterprise equipment here, so keep that in mind as well. Obviously DEC can support some application integration, but it's really a different level once you get into enterprise voice over Wi-Fi, and certainly all sorts of applications can be delivered over wireless LAN, and that might be to a voice over Wi-Fi device, or it might not be, it might be some other sort of wireless capable device that's been deployed and used in aged care today. And return on investment potential. Obviously, investing in wireless LAN, enterprise wireless LAN, does require an outlay of capital. So if we can explain to organisations how they can also realise the return on that investment in some way, shape or form, then that drives the potential to have them implement these type of solutions. So we'll have a look at how we can have some sort of return on investment argument from deploying an enterprise wireless LAN into an aged care environment. Okay, so as we said, convergence is a term that gets used a lot in relation to IT and communications technology. If we go back sort of 10 or even more years, it was often used to discuss running voice over data networks such as voice over IP, which is obviously the norm today pretty much. If we look at convergence in relation to today's discussion, we can talk about all the applications and devices and systems that we can converge together over an enterprise network, and more specifically to a wireless LAN. With the proliferation of smart devices, that's both consumer and vertical specific, and I guess today what we want to do is focus on the vertical specific or purpose-built Wi-Fi devices. But in either case, we're relying more than ever on Wi-Fi. And most of these devices don't actually give you a choice, since there's no physical network port to connect to a wired network. They may have USB interfaces and things like that. Talking about smart devices typically, but they really are geared up to run over a wireless LAN and standards-based Wi-Fi networking. It seems hard to believe that it's just 5 years since the iPad was launched. That was the first half of 2010 in Australia. Most people, if you ask them when do you think the iPad came out, they'll probably typically, take it back several years, because it's just become such a, an all-pervasive device. We use it for everything these days, and it's hard to imagine, life before tablets. So it really hasn't been that long, but it certainly made a huge impact on how businesses operate, and in aged care devices, the sort of applications that we can actually deliver to staff directly via the wireless LAN. But since that time, there's been an explosion of these kinds of devices, and they can add a lot of value and efficiency to business. And in healthcare, this is probably more true than any other vertical that I can think of. This has in turn enabled all manner of applications that can take advantage of these portable platforms and give the device users a wealth of information at their fingertips. There are devices that perform multiple tasks, where previously the user had to carry a number of devices. They can now converge these into a single device. In some cases, they can do it in one device, or maybe they can reduce the number of devices they carry to perform all these tasks. They don't have to wear a utility belt to carry all the different devices around. And that's, I guess, another example of convergence, in a sense, is converging or consolidating quite a number of different devices, or the functions that used to be performed by multiple devices into a single device, or at least a fewer number of devices. This slide, really looking at this, it gives us an example of the type of applications that we can run exclusively over wireless LAN, or certainly, that we can use either optionally via a wireless LAN or a wired LAN. So these are the sort of things that we want to have a look at in today's presentation. So if we look there, we can see, nurse call. Obviously, that's a vital part and an integral part of any aged care facility, is a nurse call system to have the residents be able to alert staff that they are in need of assistance, whether that's something like a room call or a bed call, or something more critical, in terms of, maybe they need some assistance because they've fallen out of bed or slipped in the shower, or things like that, where it's really critical that a staff member can receive that message on the fly and not have to go back to a central point, and then they can action that message. So, typically it used to be annunciator panels and things like that, but obviously in more modern times, nurse call integrates with, the cordless or wireless voice solution. So whether it's DECT or voice over Wi-Fi, a staff member can quickly receive a nurse call message while they're in transit or wherever they are in the facility, and attend to that ASAP. PBX obviously still be wired, but in the sense we're talking about with voice over Wi-Fi devices, as you can see in the bottom right hand screen there, obviously they do become an extension of the enterprise IP PBX as a SIP extension, and that's of course done via the wireless LAN there. So we're converging, and that's, again, that's common now, is to have a voice over Wi-Fi running over a wired LAN, just as VoIP in general has been quite common for a number of years now over a wired LAN. Electronic medical records is something that is widely used now. You've probably heard of companies like iCare and Autumn Care. It allows staff to, manage digital records of the residents and manage their their care plans, etc. through that, and that's typically accessed via a smart device, often a tablet, to pull down those EMR records from the the system and update them and check for details of the residents that way. Very, very efficient, rather than the old paper-based way of doing everything via charts. Location, RTLS, again, that's something in hospitals that's just standard and has been for some time, but new builds for aged care providers, tenders and things like that, we're seeing RTLS now as a standard part of a new build or a tender now these days. So it's just in the spec to have location capability. Mobile duress as well. This is probably, again, more of a hospital one to date, but certainly with dementia wards and things like that, for staff members to quickly be able to notify other team members that they're in duress, or they need some assistance quickly, they're in some sort of danger. Mobile duress is a critical part of that. Other things like CCTV, we can monitor a lot of different areas via closed circuit television. In a sense, that is part of a building management system, but BMS obviously incorporates all sorts of things like HVAC, mechanical systems, plumbing systems, etc., lighting, everything really. So while BMS is still typically very much a wired type application. It's quite common now for sensors to be wireless and to work over the standards-based Wi-Fi network. So a sensor component of a BMS system is typically wireless now, and as time goes on, the controller aspects of BMS slowly also being able to be integrated into Wi-Fi as well. Wander management, again, dementia ward's probably a key one there, having the ability via location systems such as RTLS to track residents, and probably dementia ward's a good example where they have to stay in certain areas, and if they were to be able to leave that area, it poses some sort of a risk to health and safety. So a wearable type of RTLS device is typically used for wander management, and also CCTV can be used to assist with wander management as well. So these sort of things can be integrated wirelessly and provided to the staff members via wireless type devices so they can monitor these systems as well. And then there's ancillary things, bedwetting sensors. A lot of those historically have had a closed circuit Wi-Fi connection to alert when the sensor is tripped, but more and more we're seeing these running over 802.11 standards-based Wi-Fi network. So as we said, we don't want to try and look at everything to it's quite high level, because there is so much potential for application integration via wireless LAN, an enterprise wireless LAN. So we're not going to try and cover everything, but these are some of the things that we want to have a look at in a little bit more detail throughout the presentation, because this is some of the more common things that we're seeing out there. And then, as well as that, these are specific to the industry, but keep in mind, from all these specific scenarios, wireless LAN is also useful for staff to complete their administrative tasks, which require a network connection to their PC or laptop. And if we go back several years, that was often the reason that in an aged care facility they might have a wireless access point working in their office or administration area, just for their sort of administrative tasks, even though they might have not yet been doing the things we're talking about in this presentation with a wireless LAN that sort of covers the whole area of the facility to enable some of these other things. So, for the same reason we all like the flexibility of wireless networking, we've got to keep in mind just the standard administrative tasks as well, which is served by wireless LAN. Okay, this slide here is just showing some efficiencies and how efficiency gains can be made by having nursing staff contactable, I guess, wherever they are in a facility. So rather than having to go back to a central point to check their task list or get an update on certain situations, they just continue their rounds, if you like, and continuously in communication via their device and the wireless network. So these statistics are based on a hospital environment. I couldn't find anything specific to aged care, although I think you'd find a similar situation in aged care given the nature of the patterns of carers and the other workers in the aged care space. In any case, in Australia, cordless telecommunication devices are well established, so I don't want to spend a lot of time discussing the merits of staff having a cordless phone, but rather what other applications or features can be converged into portable wireless devices to make the staff member more efficient and better able to do his or her job there. So, we're talking obviously in part things that we can deliver to a Wi-Fi handset, in terms of that same handset being their voice communication device, but other devices certainly can be brought into this sort of model, which is tablets, anything really that has a network interface and can receive information from a wireless network. But you can see there's a lot of efficiency gains there by having staff being able to be in constant communication without having to constantly go back to a fixed point and get updates. And also obviously that time there, as well as the cost saving that you can apply in the dollar sense of that time that's recovered from sort of walking back and forth can actually be used to devote to the resident care, and therefore get a better outcome for the residents in terms of their overall well-being and care. So wireless voice, voice is still the primary communication method in aged care. So that's been the case for a long time, and certainly DECT has been out in the industry for a lot of years, and has been used for staff to be able to make voice calls and receive voice calls, as well as the nurse call side of things. But voice is still the primary communication method, so that's not something that's looking at changing anytime soon. So how does it compare between voice over Wi-Fi and DECT as far as providing a cordless voice device to staff? Historically, DECT has been the main cordless handset device to enable staff to be in that communication while being mobile around the facility, and that has been the case for many years. And DECT does support voice calls and basic nurse call integration and is inherently reliable. But as the take-up of enterprise wireless LAN has accelerated, voice over Wi-Fi has become very popular. It's taking market share from DECT in a significant way. We've seen huge growth here in Wavelink in voice over Wi-Fi phones in the last 5 years, and there's a number of reasons, why that's the case. For example, with voice over Wi-Fi, obviously you can leverage the wireless LAN. You don't need to install two separate sets of wireless infrastructure, which would be an 802.11 Wi-Fi network and also a DECT network, both wireless networks, but different protocols, different frequencies, and completely separate in that sense. So if we can avoid duplicating wireless infrastructure, obviously that's a benefit to the organisation. Until a few years ago, there was concern with the quality of voice being carried on Wi-Fi compared with DECT. DECT, of course, is a closed system exclusively for the cordless phones, and as a result provides excellent voice quality, not really any sources of interference potential, things like that. So DECT is really good in terms of quality, but these days Wi-Fi can match that as well if it's done correctly. There's some other things that need to be taken care of, but as the technology advances, voice over Wi-Fi is certainly a valid use for a Wi-Fi network. And of course, as I said, enterprise wireless LAN is the key there, enterprise. So apart from the cost benefit, also simplicity of deployment, reduction in power usage and all that sort of stuff. With the maturing of enterprise voice over Wi-Fi, you can expect excellent voice quality. As we said, as long as the wireless LAN is built of enterprise-grade infrastructure. The voice over Wi-Fi handsets are purpose-built, so we don't want to be running sort of consumer-grade smartphones with a SIP client on there to communicate back to the PBX. We're talking about purpose-built handsets with all the quality, components and the smarts in the software to support enterprise-grade voice. So everything has to be correctly designed, scoped, installed, etc., and configured, for voice, not data. So if we're looking at running a voice over Wi-Fi solution, we certainly need to make sure that our enterprise wireless LAN is deployed to support voice calls. So if an environment was deployed to support data-only applications, then we typically find the number of APs is probably not enough, and the overlap between them is not great enough to support quality voice over Wi-Fi. So really probably need to re-engineer an existing enterprise wireless LAN that hasn't been deployed for voice, if we're going to add voice into the mix, or if it's a greenfield site, we'd definitely be deploying the access points in a manner consistent with correct procedure for voice over Wi-Fi to make sure that the level of service there is going to provide correct handover, correct voice quality, and all those sort of things to make sure that we can get the same level of quality from a voice over Wi-Fi as we've traditionally had from a DECT solution as well. Purpose-built devices, we just mentioned about trying to run a consumer-grade smartphone, for example, with a SIP client piece of software to register to the IPTV as an extension and make that handset operate as a fully bona fide handset. Some of the key differences between consumer-grade smart devices that you can run a SIP client on and an actual purpose-built device like the SpectraLink handsets you can see on the screen there include things like handover management. So consumer-grade handsets don't correctly manage the handover between APs, and often they'll stick to the AP rather than handing off, which results in the degradation of the call and ultimately the call dropping once the handsets get far away enough from the AP. Ruggedization. The SpectraLink handsets are IP64 rated for dust and moisture ingress, military standard for drop and shock proof. And as anyone who's ever dropped their iPhone is well aware, they don't really take much of a beating before they break. So you can imagine in an environment like an aged care facility, a consumer-grade device just really won't stand the test of time at all. Battery management, which extends to both battery life, which a purpose-built device like a SpectraLink can enhance using power-saving mechanisms in the enterprise wireless LAN and the handsets that consume the smart device's battery life. Things like WMM or wireless multimedia power save and automatic power save delivery sort of enterprise type features that you won't get in a consumer grade device like a consumer smartphone. I won't mention any brand names there, but also being able to have fast changeable batteries that allow battery management changeover, so the handsets can be back in service in 30 seconds. So if a user has a flat battery, they can go to a bank of batteries, snap one out, pop it back into the phone, and switch the one from the phone into the charger for the next cycle. And 30 seconds later, the handset's up and operational again for the rest of their shift. So we can have multi-charge banks distributed around the facility to enable users to quickly and easily change batteries whenever they need to. So, obviously with a consumer-grade smart device, you typically have to plug the device into a USB charger, which takes the handsets out of use while they charge, so they're no good really for walking around while they're on a charger. And it's not really an enterprise solution for charging to have to plug a USB cable into a handset. Certainly not what you'd expect in an enterprise environment like an aged care facility. And also carrying options. There's a lack of suitable carrying options in consumer smartphones for healthcare environments. Things like belt clips, cases with wipe down capability like silicon material cases, and cases that have access to snapping out the batteries without having to take the cover off, all those sort of things which you can get for purpose-built devices and you just can't get for consumer-grade devices. So for all those reasons, really it's critical to run the right device for the environment, so it'll enhance the staff usage of that device. Another key theme we'll see throughout the presentation is the cost saving that you can achieve through device consolidation. So using a wireless voice handset to perform many other tasks that previously you would have had to use a specific device for. So we can bring a lot of that functionality into a device like the handsets you see on screen here, and then we can do away with other things. And application integration capability of voice over Wi-Fi as well. Capability for integrating the handsets with third-party applications is huge. Unlike a DEC system, which can support basic integration, voice-over Wi-Fi devices, and obviously we're talking about SpectraLink in this case, offer a highly sophisticated open application programming interface, or API, for application integration, and they use standards-based programming language and methods, so things like HTML, XML, JavaScript, AJAX, etc., and WebKit browser to support integration to any application that you could get a developer to write an interface for. And in a lot of cases, those integrations have already been written by a lot of companies, say nurse call providers, middleware providers, workflow and task management type providers. So a lot of these things have already been written for the SpectraLink handsets, but certainly with the API capability and the standards-based languages that they use, there's really the sky's the limit as far as the type of applications that can be integrated. If you look at the images on the screen, you can see actual examples of applications delivered to the SpectraLink handsets. The visual information that you can convey to staff using the handsets is far beyond anything you can do on a DEC handset because of limitations on both the APIs on the DEC systems and also the capabilities of the DEC handsets, even if you're using enterprise DEC solutions. So you can see there, it really is visual and not text-based that delivers a lot of information at a glance to the user. If you think back to the sort of DEC handsets and the early ones especially, you might have a line or two of text on a black and white screen. Really doesn't convey a lot of information, certainly at a glance. If you look at the screen there, you can see there's a lot of things that you can do on a voice over Wi-Fi handset. And these days, especially with people being used to applications that they would run on their smartphones, it's quite important to be able to give them an equivalent level of service on their purpose-built devices. So I suppose looking at convergence from the voice over Wi-Fi handset point of view rather than the more holistic wireless LAN point of view that we discussed earlier, these are the types of applications that you can basically integrate with the handset. So we'll have a look at some of this stuff in more detail in the next few slides, but you can really see, and we talked about converging a lot of functionality on what used to be a dedicated device for each into a single device, or at least reducing the number of devices. These are the sort of applications that we're talking about. We mentioned the importance and how widespread nurse call solutions are in aged care. So what we're starting to see now is voice over Wi-Fi nurse call points. So points that will have a wireless radio in them, and can communicate with the nurse call server directly over a Wi-Fi network. And obviously that delivers flexibility in terms of cabling. You can easily and quickly deploy them. You don't need to get cabling, and sometimes it's very difficult to get cabling into certain locations, especially in the older buildings where you typically want to locate a nurse call point. So, there's a number of different nurse call vendors who have, added Wi-Fi nurse call points to their solutions. And the battery and the power consumption is consistent to get a long life out of a battery in a wireless nurse call point. All connected via standards-based 802.11 Wi-Fi networking, so not proprietary communications there. This is stuff that we can run over an enterprise-grade Wi-Fi network. And as we said, it just gives a lot of flexibility in terms of eliminating cabling and the cost associated with cabling as well, which, as you know, in an environment, especially an older environment, can be really expensive to get cable points run to difficult areas. Duress. Well, duress is very standard in hospitals these days, but certainly in aged care as well. It's become quite important in certain areas, and again, we've mentioned dementia wards a couple of times there. But if a staff member needs to quickly signal that they require assistance, and sometimes they don't even have the option to press a button that all the handsets and devices would have to manually indicate that they would need some assistance there. There's smarts built into the devices that actually allow the user, or allow the device to signal to the duress scenario and whatever other components are involved in that escalation, based on say the position of the handset, or if they're in a state that's consistent with someone running or moving in a way that's not normal, then the device itself can signal that duress to the system, even if the user isn't capable of manually doing that. So it might be an accelerometer inside the hardware, that if the phone gets tilted on a certain angle, or it's in a horizontal position, or it just hasn't moved for a given amount of time, then that can all be used to trigger a duress scenario there, and that's done via the Wi-Fi. And obviously that allows the users on other devices who are also mobile to receive that duress message and be able to respond. The Ekahau tag there is what's been used for quite some time, but the phones now themselves actually contain capability to do this kind of thing. RTLS, real-time location system. Obviously we mentioned earlier about tracking devices, and not only devices but people, human assets throughout a facility. That can all be done via RTLS. So essentially what you have is a locationing engine which receives triangulation information or compiles information from the Wi-Fi access points, and that information is delivered from the devices themselves via a beacon that it sends to the Wi-Fi network. So the locationing engine can compute all the information from these beacons that the devices send, and then work out the location of the device or user, and then that's how we do the tracking. So we can track from a distance. Someone, a supervisor or a nurse in a nurse's station, can have a real-time view of where a certain device is in the facility there. Tracking for safety or security. In the previous scenario, we're talking about duress. Well, if someone presses a fixed duress point, say an alarm panel or a button on a wall, then obviously we know exactly where that person is when they press that duress. But if that duress is signaled from a mobile device, such as a Wi-Fi handset or an Ekahau tag, or one of these wearable type things, then how do we know where they are? Well, the RTLS plays a part in that escalation as well. So when the duress is pressed on the device or signal from the device, the location information, if that device can also perform or send RTLS beacons, that information can also be added to the message that is sent to the recipients. So they can see that staff member needs assistance because they've sent a duress alarm and they're in a specific part of the building. And that way the responders know exactly where to go to assist them at that time. So RTLS would have that in the phone. So the SpectraLink handsets have an RTLS beacon built into that. So they can actually, just as a soft client, send RTLS beacons to the network. If it's an asset like a medical cart, or an IV drip or a wheelchair or something like that, then we'd simply put a tag on there, and that tag will actually be the thing sending the beacons back through the network so that they can be located there. If you want to take it one step further, you can actually, with the appropriate level of development, you could do a lookup from the SpectraLink handset referencing the RTLS location engine and an asset that's logged on there. So let's say a carer needed to quickly find a wheelchair without having to search the whole facility for that wheelchair. If that wheelchair had an RTLS tag on there that was sending beacon information to the network, then a staff member can potentially go through a menu on the handset and locate that device quite quickly and easily, and then just go and collect it rather than have to search for it. So that's another big time saver there. Some of the wearables like the wristbands and the watch type devices, or it might be a pendant, are also quite heavily used for dementia patients as well, so in dementia wards, and that allows them to be tracked around, and that comes back to the wander management that we talked about earlier. So increasing safety aspect and also the workflows for staff and residents. EMR, or electronic medical record, is basically a collection of resident health information stored in a digital format. So EMR records are shared through a network-connected enterprise-wide information system, which would cover typically all the different resident sites throughout an aged care provider's network. So typically they'll include information about the resident, including the demographics, the care plans, medical history, their medication management, any allergies they might have, personal statistics like weight and age and all those sort of things. So basically the EMR system is designed to provide an accurate capture and storage of the state of a resident across time and eliminate the need to track down a resident's previous paper medical records. So rather than having a whole lot of different paper records all over the place, that's very hard to manage. Everything's centralized into the EMR record, and then via their smart device, a carer can then quickly and easily basically get the information from the EMR. And if you're running a device with a barcode scanner, and again, some of the SpectraLink handsets have that capability, you might scan a patient's bed chart and then via that have that automatically take down the record onto their phone or their smart device of that EMR for that particular patient, so they can be cared for in the best possible way. They also allow minimization of data replication because there's only one modifiable file, which means the file's more likely to be up to date, and it decreases the risk of lost paperwork, and also lets the staff identify long-term trends and changes in the resident's health because they've got all that information at their fingertips. Messaging, task management and workflow. So messaging in an aged care environment and healthcare in general can sometimes be a more appropriate way to communicate some situations, and secure messaging application should be used because you've essentially got personal resident information being talked about and I guess residents being mentioned in terms of their health and things like that. So smart devices, while they typically by default enable a standard messaging capability, really should be used a secure messaging application which you can run on smart devices as well. And also there's the aspect of letting staff communicate silently in environments where you need to be quiet. So if you've got, say, a resident asleep or recuperating in a room, rather than the carer having to make a call to someone else inside or outside the facility to get some information or have a discussion about the resident, sometimes it's better to use messaging because you can be quiet and you don't have to disturb that resident at all. So that's another reason with the messaging, how it is a useful feature to have. With task management and workflows, you can enable staff to manage their tasks efficiently and consistently and with the right priority, and it lets them close tasks so the system's updated to show the task has been completed, and everyone can actually see that yes, that task has been completed, and then move on to the next task. The workflows let the staff member manage event-driven responses and action from simple tasks to complex workflows. Workflows also eliminate reliance on memory-based tasks and provide decision support for efficient allocation of resources. And they allow management to interact with the workforce seamlessly in real time. So a lot of this task management and workflow is all completely automated from a messaging platform. And having the devices be able to receive the different types of tasks, have the user of the device view and prioritize their tasks, and then also indicate via ticking off a task as it's completed, that has been completed, and that automatically updates all the other components in the solution as well. CCTV. So CCTV's been around for a long time as well, but the way that we can view feeds from CCTV has changed quite significantly over several years, and there's a lot more flexibility. I know a lot of people remotely monitor their homes and businesses via an application on their computer. So we're all quite aware of that. So some of the benefits is the ability to monitor areas of wandering residents, again wander management from mobile devices, and the pictures on the screen there sort of give you an idea of how that works. Reducing the wander risk, improving safety and security in general. And some of the other capabilities there, cut down on unnecessary trips. So a commonly used scenario is if you have I guess an automated door lock with a camera built into it, and there's a delivery or someone rings the bell at the building, a staff member, without having to actually walk down to the door and verify the identity of the caller, can actually tap into the camera feed from their device, and then if they verify the person's identity and that's a valid caller, they could even pop the door lock by entering a DTMF code on the handset, which is commonly done. So again, just saves a lot of walking around and also enhances the security. IPTV, or Internet Protocol Television. So IPTV entertainment and communication systems for residential aged care facilities, they're fairly commonplace today, and in new facilities they're becoming TV system of choice, and that's over typically main antenna TV, which has been common for a long time. This type of services you can include in IPTV, things like local free-to-air content, HD pay TV packages, things like Foxtel. You've now got streaming services like Netflix and Stan, and these can be delivered to TVs throughout the facility in common areas and the residents' room. Aged care organisations can also leverage the IPTV platform for information delivery, so things like notifying residents of activities and events for the day or the week, menus. They also allow you to do things like in-house video, promotional material. You can even do wake-up or medical alerts. You can have personalised and facility-wide messaging or alarms as well, delivered via the television. Obviously, streaming IPTV or video content in real time places quite a bit of load on a network, so it might surprise some of you that delivering this kind of application over enterprise wireless LAN is not only possible but commonplace in education environments where you typically have a lot of streams going from a video to multiple students, and sometimes the whole class full of students on their tablets in real time, so Wi-Fi can handle. So while that might surprise some of you might have a smart TV at home with 802.11ac wireless built into it and have native support for Netflix, and all that's becoming standard in new model TVs. So what we would certainly suggest is you would want to run IPTV over 802.11ac, which is the current standard of wireless networking, and certainly supports huge amounts of capacity and speeds and throughput and all that type of thing. Because we're really talking about running high capacity applications, high bandwidth utilization, as well as that we're running a lot of other applications like we've been talking about. So we want to make sure that we've got plenty of bandwidth available. While QoS is a part of the way to manage all of that, the capacity and speed that AC offers makes IPTV over Wi-Fi a real solution. Today, various commercial IPTV systems still might use set-top boxes that connect to the wireless LAN and have a cable going to the television, but the current generation of smart TVs are natively now supporting 802.11ac, so we're at the point where IPTV can be directly streamed off the Wi-Fi infrastructure straight onto the TV. As we've already said, there's plenty of smart TVs with native support for Netflix and apps to connect the TV with IPTV streaming services on the web. Smart TVs now becoming the norm. This is changing the delivery of commercial IPTV systems like the ones found in aged care facilities. Resident usage. Okay, so we've obviously been talking about functions that the organisation benefits from and the staff members, but what about the resident usage? Because obviously the most recent resident generation are a lot more tech savvy than their predecessors were, and they want to access the internet for a number of reasons. So it could be keeping in touch with the family, A lot of them like to Skype their grandkids. A lot of them will be remote from their family in terms of might be in a different state, so they don't often have, or some of them might have the ability to receive visitors directly, so Skype gives them a really good platform to keep in touch. They like to do email, just general browsing, keeping up to date with the news, maybe their personal hobbies, all this stuff that they like to do on the internet. So this is really where the organisation has an opportunity to make a return on investment on the cost of implementing the enterprise wireless LAN. So the aged care provider can effectively become the service provider for the residents' internet access and charge the residents for the access. And also that means basically that it could be incorporated into the service billing for the residents, so it makes it simpler for them or their families since it's just another item on their billing. And that way they don't have to organise a separate internet access like cellular type service or something that might be more difficult for the resident, and if they run into any sort of, I guess, issues sort of on their own a little bit there. So it's an obvious way for the organisation to reduce their TCO or total cost of ownership for the wireless network. If we want to start doing things like that in terms of allowing resident usage of a wireless LAN, then obviously we really need to manage that. So we don't want to have any crossover between our corporate wireless LAN, which is used for all the corporate applications we've been discussing, and have that sort of bandwidth being vulnerable to usage if one of the residents starts doing some heavy applications on the internet. So we need to manage all that, and BYOD, bring your own devices, is very common now, and that would typically be the type of arrangement that the residents would have. They have their own devices, might be tablets or laptops, etc. So we need to manage that. There's a number of ways we can do that. One of them is simplifying the device onboarding. In the past, many organisations have been reluctant to allow BYOD on corporate wireless LANs because of the lack of control over the device and also the lack of IT resources to manage the onboarding of users and devices onto the network. So we can have a platform that simplifies device onboarding, makes it very easy for a non-technical user to start up their device, go typically to a captive portal when they open a web browser, and then they could input their credentials, which will be supplied via the organisation there, and then they would get securely authenticated onto the network. And obviously, by then having that take them onto a separate VLAN or virtual LAN on the network, they're completely segregated from all the corporate traffic and sensitive information that might be on the network, and they can't access that. It also means that the organisation can put quality of service controls on there to make sure that the corporate traffic and applications will always take precedence over the resident usage, and that way always reserving plenty of bandwidth for the critical type applications. So we're talking about enterprise strength 802.1x authentication, things like radius authentication, to make sure that we have only secured devices and secured connections to the network, and we make sure that we don't have capability for visitors of the residents to come and connect unsecurely to a network and potentially compromise our security situation there. And we can also use a platform like this. So in this case, we're talking about Maru Connect, which is completely vendor agnostic as far as the wireless LAN is concerned. You can put this on a Cisco, Aruba, HP, whatever you like to do. But we can also manage the wired and wireless devices on the network as well there. You've got visiting medical officers, so that might be a specialist consultant who covers multiple aged care providers and facilities. Things like physios, specialist medical or doctor type people, might be psychologists, so they'll often visit in a professional capacity, and they might typically need internet connectivity to access their own applications and databases. They might even need to access a local print service, but the organisation still wants to keep them separated from the corporate network. So there's all these different levels of access that can be managed via an enterprise network access type platform that we really want to use when we're doing these types of scenarios here. We can also have integration with PayPal, credit card providers if you want to do billing like that. We can enforce preset bandwidth and data limits for each individual resident if we want to do that as well. We can have, so once they first connect to the network, they don't have to remember the username and passwords, etc. If we allow that, we might have them authenticate once, and then that device is authenticated for an extended period of time or whatever we decide to allow for that, because we don't want to make it difficult for them to use. And we can also then sort of monitor the activity of the residents, and we can report on that to monitor trends and also appropriate usage policies and all that sort of stuff as well. And it also gives additional capabilities to do things like mobile device management, or MDM. So you may have heard of MDM, which allows the organisation to make sure that any BYOD devices are securely onboarded to the network. They've been through certain auditing processes, for example, make sure that they've got an antivirus on there and that's up to date, make sure certain other parameters are configured a certain way so it won't compromise any security on the network before that device is allowed to go on. For corporate-owned devices, such as staff-owned devices, MDM would also allow them to make sure there's appropriate security policies in place, so if a device is lost or stolen, then that can be locked or wiped as well. Okay, so just to wrap up, obviously we've talked about a number of things there, most of them related to the organisation and the workflow of the staff, but we've also talked about residents' usage as well and other things. So just to wrap up on some of the key points there is a huge application pool, and when we say applications, both application in the terms of what we think of as an app on a device, but also the different scenarios that wireless LAN enables us to use and implement to have efficiency gains and things like that. So we get a huge increase in efficiency. We've got a lot more flexibility in how staff operate in the environment. Being mobile, and the nature of aged care workers is very mobile, so being able to access all information and services while they're on the move is a real bonus in terms of flexibility, and also delivers cost benefits as well. And if we're allowing resident usage, we can certainly provide a return on investment case, which will make it an easier sell to the organisation, since they realise that they will at some point certainly can break even on their investment, or even potentially make some additional revenue from being an internet access provider to the residents as well. Okay, thanks for your attendance. What I want to do now is just throw it open to any questions. You should have in your GoToWebinar control panel, there should be a questions box if everyone wants to type any questions in there. So I'm just going to check the question list, see what we've got. Okay, so we do have a few questions. First one is DECT still being deployed in aged care? The answer is yes, DECT certainly is still being deployed in aged care. It's losing, I guess, market share to voice over Wi-Fi. It's still pretty robust. We're seeing a trend that any greenfield sites that are being deployed are typically done as voice over Wi-Fi for all the reasons that we've mentioned throughout this webinar, and the fact that enterprise wireless LAN is almost a standard these days in terms of part of a standard build for an aged care facility. So DECT is still there, and we estimate it will be for some time, because you do have different types of facilities and organisations. Some are fairly low tech and basic, others are quite at the forefront technology-wise. They have different type budget restraints. So there's definitely arguments for DECT and areas where DECT is very good technology, and that's not going to change. So what we'll see over time, I think, is a tapering off of DECT. We're already seeing that, and a ramp up of voice over Wi-Fi, and that's in evidence today and set to continue. But yeah, there certainly still is DECT being deployed in aged care. Would a Wi-Fi network design typically be sufficient for accurate triangulation for RTLS? That's a very good question. So just as I mentioned that if we were deploying a Wi-Fi network for voice as opposed to data applications, if we were going to deploy a wireless network for RTLS, then we'd have to take that into our design consideration very strongly. So just to, I suppose, put some detail around that, data would be the least fussy, I guess. I'm trying to think of a better word there, but as far as the spacing and the number of AAPs and the signal strength and the overlap between our AAP network, data only has the least level of service requirement. So we could space them further apart. The signal strength from the device to the AP could be lower than it could be with voice. If we go to voice, the APs need to be closer together for better overlap to allow handoff on an active call, and just a general better service level. So we'd have more APs closer together. If we want to do RTLS, then typically we're going to have more access points again. Now it really comes down to how accurate do we want our triangulation to be. The more access points that we have in the environment, the more accurate the locationing of a device will be. So if we had a requirement on a spec to be able to track to within, say, 3 meters or 5 meters or 10 meters, that would influence how many access points we need and how close together they would be, because the device typically has to be able to see a minimum of 3 access points for accurate triangulation, and the more it can see and the stronger the signal for each of those access points to the device, the more accurate our RTLS location will be. Another thing to keep in mind is if the application was voice or data, we typically would put the access points as centrally located as possible, and what I mean by that is we would typically run them down hallways, areas where people walk through, and then that coverage should go into the rooms either side of the hallway. If we're going for RTLS, we typically try and put our APs towards the edge of the coverage area. So now we might start saying, well, we're going to put them in rooms over towards the external wall, because what we're trying to achieve is triangulation. So we want a much greater spread of APs, so the triangulation will be more efficient. So yeah, absolutely. Much different network design from data to voice, and again for RTLS. What recommended bandwidth would you allow for per screen? I'm not quite sure what you mean by screen there. Oh, for IPTV. That's a good question. Look, I don't know, to be honest, the exact amount of bandwidth. I'd have to check that and get back to you, but certainly we'd be talking typically, higher than you would for voice, because we're talking video protocols. Voice we typically want to allow, up to about 100 kilobits per second in each direction. There's different encoding types that you could use for video as well. That'll have some sort of impact. So it'll depend on what encoding type we're looking at, but I'm not exactly sure of a range that I could accurately give you. So that's something happy to follow up and pass on to you after the presentation. And another question here we've got is, if we wanted to skill up on wireless LAN, what is the recommended path? So wireless LAN is obviously quite a complex technology, and running voice over wireless LAN adds another layer of complexity to it. That's not to discourage anybody, it's certainly achievable. We've had many resellers sort of make the transition from a DECT background as far as the integration, and are now very capably supporting and deploying both wireless LAN and voice over Wi-Fi as well as DECT. Typically what I'd recommend is you would get some demo kit, some NFR kit, and establish that in your own environment. There's vendor training courses, for example, Maru Networks, who we distribute, have a engineering level certification called MCE, Maru Certified Engineer, which covers in-depth and through both theory and practical work, deployment, management, maintenance, and ongoing administration of an enterprise wireless LAN. And then there's also a number of industry-based certifications. Some of them are vendor-based and others are sort of open or vendor agnostic, such as the CWNA or Certified Wireless Network Administrator courses. So there's a number of different things that you could do in order to get skilled up to deploy and maintain wireless LAN and voice over Wi-Fi for your customers. And if you'd like to know more of that, please contact Wavelink and we'll be happy to discuss further. Okay, that's all the questions. I want to thank everybody very much for attending. I hope you found the presentation worthwhile, and as I said, we'd certainly be happy to discuss any of this further with you. So if you'd like to contact us, there's our contact information there, and look forward to doing some voice over Wi-Fi and wireless LAN business with you shortly. Thanks very much.